Hi, good evening, everybody. It's good to be back. Um, this is the Clean Scalpel. We're back, and today we're going to be talking about handling any kind of pickup with your left hand. Um, Again, the goal of this channel is to start making you think how athletes think about their sports and figure out a way to practice our craft, really. I really want to thank everyone that's contributed after the first video from a long time. I have some really good ideas from medical students, residents, and even peers about other topics to discuss. Um, Later on, probably next week, we'll be going over some tricks to palming. I had a couple of people ask me about is there any secrets or things they can do, or if I can show that a little bit better. So we'll get to that. Somebody else suggested stories from the battlefield, so talk about difficult technical situations you were put in and then what you did to get out of it. And I think I'll start incorporating that, so thank you very much. But today we're going to keep it short and simple. We talked a little bit last time about using a needle driver, and now it's really the other part of it, which is using your left hand for the pickup. Now, I think I have to mention some of the things that were mentioned to me when I was in training, when I wasn't using my left hand adequately. One of them was, hey, I didn't know you had a right hemispheric stroke. Yep, that was told to me. The other one is, hey, I didn't know you were using your left hand to flip burgers. And you'll see why people said that when I show you what I was doing. So without further ado, this is the Clean Scalpel, and today we're going to talk about using your left hand. So let's look at what we're going to be working with today, and essentially it's needle drivers, which I have one here, but more importantly, we have our pickups of different lengths on the left side. So very simply, where is it supposed to go? Well, I'll use our smaller one here, and the best way to think about this is like having chopsticks in your left hand. You want the base of it to rest in between the web space of your hand. Why? Because that is the third point of fixation. So it's going to rest. You're going to use your index finger and your thumb to control the rest of the pickup. This gives you control, it gives you strength. The strength is something you will have to, again, develop over time, especially when you're doing redo cases, because it becomes very difficult to hold the tissue. But this is how it's done, and when used appropriately, you will not be told that you've had a stroke in this left arm. But let's go over, I think, some of the most common problems that people have when they first use pickups. So the tongs reference I mentioned earlier was this. I see a lot of medical students and early residents when they're trying to get the reach, when they're trying to get a needle to pick up, they will get their hand over top of it and grab it like this to control it. Again, the problems, as some of you senior people are watching, is that it's obvious you really lack the control and support versus the tripod position, which allows you to control it. The other really nice thing about this position that a lot of people don't pay attention to is where it rests. So again, I'm using the palm, and that's my base. So that base allows then for a more secure and stable positioning of the left hand. If you have it in the air, it's a little bit less stable, and you notice that even the best of people will have a slight tremor, which may change the position of the tip of this. Okay. Again, as you use longer and longer needle drivers, it is more and more imperative that you have this technique down, because trying to grab something like this with a long needle driver becomes almost impossible. Similarly, with the longer needle driver, the concept is the same. You want to have the base of it sit within the web space. Use your fingers, try to get as distal as possible. Now, the other thing I've seen some people do is they choke up like this a lot. The problem with this is that you can get away with this when you're working on the skin, but imagine working deeper into the field. Your fingers aren't going to necessarily let you get in there, so you have to start getting used to shifting that position further out, and so you have more control. I have seen other people use these fingers as support and stability, and I don't think that's wrong, and I wouldn't necessarily criticize you for that. So again, more importantly, how do we practice this? This is easy. Pick up one of these. Again, there's a lot of peel packs that have some of the simpler ones. get used to holding it with your left hand. And I actually, knowing that I was going to go into surgery, I started hilariously using chopsticks with my left hand. Make sure you're wearing a shirt that you can don't mind getting rid of, because it does cause for some pretty hilarious accidents. And that's really it for this quick and dirty, guys. Thank you again for all the people for the last video that gave me a bunch of ideas. I think the next video I will put out is some of the small technical things you need to do with palming, because clearly there's a lot of people that find palming sexy and they want to incorporate that into their technical practice. Otherwise, thank you for your time, and we'll see you then.